Okay, good afternoon, everyone. Good afternoon, Doc Bing, and good afternoon, classmates. So for today's lesson, we have the leptospirosis. For the rationale, it is important to conduct a case study because it helps researchers to first understand more about the body's immune system response to a disease and work out how to prevent the disease or improve its treatment, most especially for different antibiotics, and test the effectiveness of potential new vaccines and treatments. I chose to study this disease because it is well known, yet not everyone knows its nature, possible risks of infection, its season, mode of transmission, the treatment, and the prevention. So that's why we're going to discuss all the information that could be used in times of need. So leptospirosis is a common health concern not only in the Philippines but across countries worldwide. Although it is a common disease, people should never underestimate its effect because if it is not treated as early as possible and without proper medication, it will cause serious illnesses in internal organs and can lead to death. Now, the aim of this study is to give you the right information of everything you should know about the leptospirosis that will eventually help you to be knowledgeable enough for what you will do to keep yourself, family, and community free from infection and do the things that will contribute in preventing the spread of this kind of infectious disease. So what is leptospirosis? Leptospirosis is a bacterial disease that affects humans and animals. Humans can become infected through contact with urine from infected animals or contact with water, soil, or food contaminated with the urine of infected animals. In humans, it can cause a wide range of symptoms, some of which may be mistaken for other disease. And some infected persons may have no symptoms at all. Also known as field ever eye cutters yellows, the 7-day fever, cane field fever. Disease was first described by Adolf Weil in 1886, professor of medicine at Heidelberg University of Germany. The causative agent of leptospirosis is Leptospira. It's a genus of spirochete bacteria, including a small number of pathogenic and saprophytic species. The ancient Greek leptos means fine or thin, and Latin spira means coil. Corkscrew-shaped, delicate, flexible spirochetes, about 6 to 20 meters long and 0.1 micrometer thick, possess a large number of closely wound spirals and characteristics and hooks. So if you can see no doon sa image natin na nasa gilid, no, meron siyang major characteristics na end hooks na parang sima doon sa pagbibingwit ng isda. And actively motile, it was first observed in 1907 in a kidney tissue slices using the microtome of the leptospirosis victim who was described as having died of yellow fever. So Seychelles, a country in East Africa. The Seychelles is an archipelago of 115 islands in the Indian Ocean of East Africa. It's home to numerous beaches, coral reefs, nature reserves, and rare animals. So the data shows the number of leptospirosis cases that the country had for each age and gender. So we have the the number of cases, the age, and also the gender. So if you would be noticing, for the chart or the data na showing in your screen, medyo mataas yung cases ng male and to 20 to 29 years old. That is because the main reason is they need to go in the beaches or in the forest and mountains or different area to have their foods, to get their foods and to get their jobs. So ito yung pinaka-best na ages, ito yung best na gender na makakakuha ng sakit ng leptospirosis kasi nagkakaroon sila ng activity outside their homes. And Seychelles Archipelago has been reported as the country with the highest human incidence of leptospirosis worldwide. Although figures are based on dated studies and or poorly specific tests. Leptospirosis is associated with water exposure, contact with animals, farm and agricultural workers. So sinabi ko nga kanina, na nasa ages 20 to 29 years old yung mostly infected ng ganitong sakit. It is because yung mga trabaho nila is more on sa farm and agriculture. And of course, poor sanitation. Floods and heavy seasonal rainfall in the tropical countries have been considered to be a major cause of outbreaks. When illness does strike Africa or poor infrastructure marked by the poverty, malnutrition, crowded living conditions, limited healthcare, and an unstable political climate permits disease to spread undaunted. It's the man-made aspect of the problem that so perturbs the expert. So we all know na kapag nasa Africa or mga part ng Asia, medyo ang way of living kasi nila doon medyo mababa or medyo mahina yung healthcare services nila, hindi siya ganoon ka-powerful compared to that of ibang countries. And kapag masyadong mababa or masyadong mataas yung level of malnutrition or yung case ng malnutrition, ibig sabihin mababa din yung immune system. And kapag mababa yung immune system, the more na mas matatamaan ka ng mga ganitong sakit. And of course, sinabi ko kanina, we have the poor sanitation. Epidemiology, leptospirosis is an often neglected tropical infectious disease caused by the spirochetes of the genus Leptospira and is considered as one of the most widespread zoonoses in the world. As a zoonotic disease, leptospirosis is a good example of the One Health concept, for it links humans, the animals, and ecosystems in a web of pathogen maintenance and the transmission, either direct or indirect contact with the urine of an infected animals. So, kapag sinasabi rin natin, kapag sakit na leptospirosis is more on the rats. But kapag may mga infected na ang animals na infected ng leptospira or ng leptospirosis, mataas yung possibility na maka-infect din sila sa tao. Kaya meron tayong One Health concept where it links humans, animals, and ecosystems. The incidence is significantly higher in warm climate countries than in temperate regions. So, rats are likely considered as one of the most or as one of the source of bacteria that cause the infectious disease. During heavy rain, animal urine in the soil or on other surfaces can run into the floodwater, contaminating it. So napaka-common nito kapag nasa crowded or doon sa mga bahaing lugar. This because yung animals or yung urine of animals is mapupunta, may hahalo siya doon sa floodwater. And if you have the open wound na tinatawag, Yun yung point of entry no, ng bacteria. And cases of leptospirosis can increase after flood when people may have to wade through contaminated water or use it for drinking or bathing. So risk of exposure, leptospirosis occurs worldwide but is most common in tropical climates. It is an occupational hazard for many people who work outdoors or with animals, such as the farmers, the mine workers, the sewer workers, slaughterhouse workers, the veterinarians and animal caretakers, fish workers, dairy farmers, and military personnel. After floods or heavy rains, anyone who has been in contact with floodwater, contaminated freshwater, rivers and streams, or soil could be at risk for infection. So some activities that increase your risk of leptospirosis include drinking from potentially contaminated water resources, including the floodwater, streams, rivers, or unsafe tap water. Bathing or wading in floodwater or contaminated freshwater, especially when putting your head underwater or if you have an open wound or scratch. Eating food that has been exposed to contaminated water or potentially urinated or on by infected animals. So Leptospira, the bacteria that causes leptospirosis, 21 species identified, 13 species detected in human cases. So patient with leptospirosis. Leptospirosis is generally treated with antibiotics and supportive care, but when not treated early, there is still a risk of having damage on the internal organs. We have here the mode of transmission, direct contact with urine or tissue of an infected animal, through skin abrasions, intact mucous membrane, or indirect contact, broken skin with infected soil, water, or vegetation, through ingestion of food and water contaminated by Leptospira. And for the droplet infection, inhalation of droplets of infected urine. And then we have here the major signs and symptoms. So in humans, leptospirosis can cause a wide range of symptoms, including high fever, headache, chills, muscle aches, vomiting, jaundice, or yellow skin and eyes, red eyes, abdominal pain, diarrhea, and rash. So ito yung symptoms no, ng leptospirosis. And then the Ministry of Health has warned that many of these symptoms can be mistaken for other diseases. In addition, some infected persons may have no symptoms at all. The time between a person's exposure to a contaminated source and becoming sick is 2 days to 4 weeks. Illnesses usually begins abruptly with fever and other symptoms. So leptospirosis occur in 2 phases. The first phase is the septicemic phase. About 5 to 14 days after infection occurs fever, headache, sore throat, severe muscle aches or aches in the calves and back, and chills occur suddenly. The eyes usually becomes very red on the 3rd or 4th day. Some people have cough, occasionally bringing up blood, and have chest pain. Most people recover within 1 week. So for the second phase or for the immune phase, in some people, symptoms return a few days later. They result from inflammation of the immune system as it eliminates the bacteria from the body. The fever returns and the tissues covering the brain and the spinal cord or meninges may become inflamed. This inflammation, meningitis, causes a stiff neck and headache. The lungs can be severely damaged. The illnesses last from a few days to 3 weeks or longer. Without treatment, recovery may take several months. So we have here now the two phases of leptospirosis for the septicemic phase and for the immune phase or phase. So we have the acute phase and also we have the immune phase. So for the clinical criteria, history of fever within past 2 weeks and at least two of the following clinical findings: the myalgia or the myalgia, headache, jaundice, conjunctival suffusion without purulent discharge or rash. For example, the mucolopapular or petechial, or at least one of the following: aseptic meningitis, GI symptoms for the abdominal pain, nausea, vomiting, and diarrhea. Pulmonary complications, the cough, the breathlessness, the hemoptysis, cardiac arrhythmias, ECG abnormalities, and renal insufficiency, or the anuria and oliguria. So for the treatment, if you have symptoms of leptospirosis, contact or consult a doctor right away. If your doctor thinks you have leptospirosis, they will likely give you antibiotics. Treatment is most effective when started as soon as possible. So mahirap mag-self-medicate no, kapag mga ganitong sakit. It is because mostly ang tinitik na gamot would be the antibiotic. So kailangan ng prescription no, ng mga health professionals. So for the indications, we have the mild leptospirosis, we have the doxycycline, the amoxicillin, and ampicillin. So based no, doon sa chart natin, dito sa screen natin, we have different dosage. And for the moderate or severe leptospirosis, we have the penicillin, the ceftriaxone, and cefotoxam. So we have here the different treatments options. We have the different antibiotics, most especially no, kapag medyo moderate lang yung leptospirosis. We have the amoxicillin, we have the doxycycline, and so on and so forth. Okay, so preventing leptospirosis, according to World Health Organization or the WHO, wear protective clothing, cover skin lesions with waterproof dressings, don't wade or swim in potentially contaminated water, wash or shower after potential exposure, clean your wounds, don't touch sick or dead animals, and consume clean drinking water. So leptospirosis can have mild flu-like symptoms and can appear similar to dengue, typhoid, and viral hepatitis. The fever, the chills, headache, and muscle pain. So consult a health professional if you have symptoms of leptospirosis and have been exposed to contaminated water. Don't self-medicate with antibiotics. Okay, thank you for listening. That's all for the topic leptospirosis. And now, okay, we're done for the leptospirosis, and now we have here the elephantiasis. So an insight to one of the most bizarre and interesting diseases known to man. So what is elephantiasis? So elephantiasis is the enlargement or what it looks to be inflating of the human body. It is also called the lymphatic filariasis. Other areas affected by this disease are external genitals. What are the causes of this disease? So it is caused by infection with parasite classified as nematodes or the roundworms of the family Filariidae that are transmitted through the bites of infected mosquitoes. Mosquito-transmitted larvae are deposited on the skin from where they can enter the body. The larvae then migrate to the lymphatic vessels where they develop into adult worms, thus continuing a cycle of the transmission. What are the effects? So in communities where filariasis is transmitted, all ages are affected while the infection may be acquired during childhood. Its visible manifestations such as limbs, edema may occur later in life, causing temporary or permanent disability. In endemic countries, lymphatic filariasis has a major social and economic impact. The arms and legs are the areas most often affected. An entire arm or leg, yung kanina yung picture sa previous slide natin, may swell to several times its normal size, resembling the thick, round appearance of an elephant's leg, hence why it is called elephantiasis. So for the symptoms, whereas disease are mostly contracted through adult, this particular disease is mostly acquired in childhood. At the start of a subclinical meaning, it's not that much of an issue to go to a clinic, but then it will start to progress to where it is dangerous. Through time, elephantiasis will produce three clinical manifestations. They are acute attacks, the lymphoedema, elephantiasis, and the hydrocele. So the adult filarial worms, which are the causes of the inflammation, are inflating the lymphatic system, leading to lymphatic vessel damage, and will cause lymphatic dysfunction, which predispose the lower limbs, in particular, to recurrent bacterial infection. These damages done to the body are the acute attacks, which are one of the most common symptoms found in elephantiasis or lymphatic filariasis, and these attacks play an important role in the development of the disease. For the miscellaneous symptoms, lymphoedema and its more advanced form, elephantiasis occur primarily in the lower limbs and are commoner in women. At its most advanced form, elephantiasis may prevent people from carrying out their normal daily activities. Lymphatic filariasis may also evolve towards a genital disease or the hydrocele that is characterized by a swelling of the scrotum and penis. The vast majority of infected people are asymptomatic, but virtually all of them suffer from damages to the lymphatic system in the kidneys and from an altered body's immune system. So for the prevention, people infected with elephantiasis who have microfilariemia or a positive antigen test should receive anti-filarial drug treatment to eliminate microfilariae. Unfortunately, no, the medicines available have limited effect on adult worms. Treatment should also be utilized by simple hygiene measures, such as basic skin care and exercise to prevent acute attacks and progression of the lymphoedema to elephantiasis. For management of the hydrocele, surgery may be appropriate. Activities beyond medical care includes having a positive attitude towards people with said disabilities. Preventive chemotherapy is used at the community level to eliminate microfilariae from the blood of infected individuals in order to interrupt transmission of infection by mosquitoes. Elephantiasis can be contracted all around the world, but the most prevalent are third world countries or regions such as Southeast Asia, India, Africa, and South America. So yung medyo mababa ang way of living, yung mga poorest country. Elephantiasis due to other causes is not rare, and elephantiasis can affect men or women at any age. So for the similar disorders, hereditary lymphoedema is an inherited disorder of the lymphatic system that is characterized by abnormal swelling of certain parts of the body. The lymphatic system is a circulatory network of vessels, ducts, and nodes that filter and distribute certain fluid or lymph and blood cells throughout the body. Lymphatic fluid collects in the soft tissue in and under the skin due to the obstruction, malformation, or underdevelopment of various lymphatic vessels. Lymphatic filariasis affects over 120 million people in 72 countries. There are three forms of hereditary lymphedema: congenital hereditary lymphedema or Milroy disease, lymphedema praecox or Migay disease, and lymphedema tarda. Symptoms include swelling of affected areas and thickening and hardening the skin in unaffected areas. In most cases, hereditary lymphedema is inherited as an autosomal dominant trait. Extra treatments. The treatment of elephantiasis always involves treating the underlying condition. Elephantiasis is a chronic lymphedema, which is why it should be treated in its early stages to prevent any further damages done to the body. However, in the majority cases, medical therapy alone is enough and surgery may be necessary as a last option. In cases where the male genitals have been affected, reconstructive surgery in the penis and scrotum has been successful. Adding to that, anti-streptococcal antibiotics are used to relieve secondary infection. Lymphatic tissue may be removed by surgery or radiation therapy. Elephantiasis is also associated with a disorder known as podoconiosis. Podoconiosis, sometimes referred to as the non-filarial elephantiasis. It is a disorder caused by the absorption of mineral particles from the soil through the feet or barefoot individuals. It is believed that the mineral particles cause an immune system response, eventually resulting in the formation of inflammatory masses of nodules or the granulomas in the lymph vessels of the feet and legs. Other information to take note that additional causes of elephantiasis include a protozoan disease called the Leishmaniasis, tuberculosis, the leprosy, and repeated streptococcal infection. Elephantiasis might also occur in trauma, surgery, and radiation if lymphedema is not treated. For example, treatments such as the surgical removal of lymph nodes to treat cancer may result in the accumulation of lymph and subsequent swelling. Elephantiasis is also not always the cause of parasites. It can happen when lymphedema is not treated and due to the obstruction of the lymph vessels of the lymphatic system. As lymph moves through the lymphatic system, it is filtered by a network of small structures known as the lymph nodes that help to remove microorganisms and other foreign bodies. Group of lymph nodes are located throughout the body, including in the neck, under the arms, at the elbows, in the chest, abdomen, and groin. In addition to the lymph nodes, the lymphatic system includes the spleen, which filters worn out red blood cells and produces lymphocytes, and the tonsils, which are masses of lymphoid tissue in the throat region that help to fight infection. Lymphatic tissues also includes thymus, a small organ that plays an important role in the immune system until puberty, as well as the bone marrow, which is the spongy tissue inside the cavities of bones and manufactures blood cells. Underlying damage to the lymphatic system may leave individuals susceptible to secondary bacterial and fungal infections that can greatly worsen the condition. Although the legs, arms, and external genitalia are most often affected, elephantiasis can affect any area of the body. The skin of the affected areas usually develops a dry, thickened pebbly appearance or pebbly appearance and may become ulcerated, pitted, and darkened. Fever, chills, and a general feeling of ill health may also be present. So in conclusion, elephantiasis is highly dangerous disease that needs immediate treatment before it gets worse. It is also caused by the bacterial infection from previous wounds that will also progress. If it is in a worse state, surgery may be needed. Parasites or bacterial infection is also not the only cause. So that's end for the topic elephantiasis. So for the next topic, we have the Zika virus. I hope na nakikinig pa rin ng lahat. So for the Zika virus, what is Zika virus? A disease caused by a virus transmitted by the Aedes mosquitoes which bite during the day. They are the same mosquitoes that spread dengue and chikungunya viruses. Zika virus is an emerging flavivirus that causes the neurodevelopmental congenital Zika syndrome and that has been linked to the neuroinflammatory Guillain-Barré syndrome. The absence of a vaccine or a clinically approved drug to treat the disease combined with the likelihood that another outbreak will occur in the future defines an unmet medical need. Several promising candidate molecules have been reported via repurposing studies, high throughput compound library screening, and de novo design with a short span of a few years. Intense research activity in this area has occurred in a response to the World Health Organization declaration of a public health emergency of international concern on February 1, 2016. In this perspective, the authors reviewed the emergence of Zika virus, the biology of its replication, targets for the therapeutic intervention, target product profile, and current drug development initiatives. Zika virus infection during pregnancy is a cause of microcephaly and other congenital abnormalities in the developing fetus and newborn. Zika infection in pregnancy also result in pregnancy complications such as the fetal loss, stillbirth, and the preterm birth. Highest cases, the largest case number of reported cases were found in the United States. So we have almost 81,115 cases. And subsequently, high number of Zika cases were also from countries such as Thailand, which is 1,044, Mexico 996, and India 671 during that period. So we have here the data shows the most high cases. So we have here the Caribbean, the Central America, the South America, and the rest of the world. A mosquito-transmitted virus in the family Flaviviridae and genus Flavivirus was discovered in 1947 with little impact in public health system worldwide for the following 7 decades. Only 14 human cases of disease were reported in countries in South Asia and Africa. So we have here the Zika virus mosquito and also the virus. And so for the infected, so ganyan po yung itsura. We have mostly the distinct characteristics would be the formation of their heads. No, yung microencephaly na tinatawag. No, parang distinct talaga yung formation dun sa noo, formation dun sa eyes nila. So ganyan yung mga distinct characteristics kapag infected ka ng Zika virus. So some symptoms is or are the fever, rash, headache, joint pain, conjunctivitis or red eyes, and muscle pain. So that would be the Zika virus symptoms. For the diagnosis, infection with Zika virus may be suspected based on symptoms and persons living or visiting areas with Zika virus transmission and their Aedes mosquitoes vector. A diagnosis of Zika virus infection can only be confirmed by the laboratory test of bloods or other body fluids such as urine or semen. Many people infected with Zika virus are asymptomatic. So meaning wala pong nararamdaman at all. Characteristics clinical findings are acute onset of fever with maculopapular rash, arthralgia, or conjunctivitis. Other commonly reported symptoms include myalgia and the headache. Clinical illnesses is usually mild with symptoms lasting for several days to a week. So for the treatment, there is no specific treatment for infection with the Zika virus. To help relieve symptoms, get plenty of rest and drink plenty of fluids to prevent dehydration. There is no specific medicine or vaccine for Zika virus. Treat the symptoms, get plenty of rest, drink fluids to prevent dehydration, and take medicines such as acetaminophen or Tylenol to reduce fever and pain. Do not take aspirin, other non-steroidal anti-inflammatory drugs or NSAIDs until dengue can be ruled out to reduce the risk of bleeding. If you are taking medicine for another medical conditions, talk to your healthcare provider before taking additional medication. We are carrying Zika virus or carrying Zika virus, take steps to protect yourself from exposure to the person's blood and body fluids, for example, urine, stool, and vomit. If you are pregnant, you can care for someone with Zika virus if you follow the steps. Do not touch blood or body fluids or surfaces with these fluids on them with exposed skin. Wash hands with soap and water immediately after providing care. Immediately remove and wash clothes if they get blood or body fluids on them. Use laundry detergent and water temperature specified on the garment label. Using bleach is not necessary. Clean the sick person's environment daily using household cleaners according to label instructions. Immediately clean surfaces that have blood or other body fluids on them using household cleaners and disinfectants according to label instruction. If you visit a family member of a friend with Zika in a hospital, you should avoid contact with a person's blood and body fluids in surfaces with these fluids on them. Helping the person sit up or walk should not expose you. Make sure to wash your hands before and after touching the person. Zika virus dynamics. So effects of the inoculum dose, the innate immune response, and viral interference. So the relationship between the infecting dose of a pathogen and the subsequent viral dynamics is unclear in many disease settings. And this relationship has implications for both the timing and the required efficacy of antiviral therapy. Since experimental challenges or challenge studies often employ higher dose of virus than would generally be present in natural infection assessment of this relationship is particularly important for the translation of findings. So in this study, we use mathematical modeling for viral load data from a multi-dose study of Zika virus infection in a macaque model to describe the impact of varying the dose of Zika virus on model parameters and develop a novel mathematical model incorporating viral interference with the innate immune response. Okay, thank you, classmates, and thank you, Doc Bing, for listening the topics leptospirosis, elephantiasis, and the Zika virus. So that would be all. Thank you, and God bless.